Hello, this is Suzanne Kellner-Zink from Dawning Visions Hypnosis, and today I'm going to speak with you about the missing ingredient in truly being able to help your patients and clients heal the underlying foundational problems that are causing the symptoms that gained them the diagnosis that they were given. We need to understand that for an individual to be able to transform their lives, it is not necessary to take medications in probably 90% or more of the mental health cases from my practice of over 20 years in hypnotism and neuro-linguistic programming. And I really don't care how complicated it is, and I don't care how long they've been ill. What I do care is that they're motivated to move on with their lives. I do care that they will do whatever it takes to transform their lives. And I do care that they're willing and able to listen to my directives, because it all comes from their subconscious, unconscious mind. This is where hypnotism and neuro-linguistic programming come in to play, because you need to understand that when we're working in the conscious mind, as you have been trained to do, you're really working in the prefrontal cortex of the mind, where all the reasoning, rationalizations, and judgments occur in your patients. Which is why when you have, for example, a depressed person sitting in front of you, and you give them suggestions on things they can do to improve their lives, they're going to sit there and say, but I can't, it's impossible, I'm scared, and all these other things, because they're reasoning, they're rationalizing, they're making the judgments based on what you're saying, instead of being able to connect what is going on in their mind and how it is harming their quality of life. It cannot be done in the conscious mind. It's impossible. And you all know this because you've worked with patients, probably some of them, for decades. Because I had some clients come to me who work with their traditionally trained mental health professionals for decades. Yes, indeed. And no one needs to be working with anyone for decades if the person who's doing the treatment actually knows how to help the person heal. It's a fact. Hypnotists and neuro-linguistic programmers have been doing this for a long, long time now, especially hypnotists. You know, Dave Ellman was a wonderful layperson hypnotist who was asked by doctors and dentists to help them, to help their patients that they were finding really difficult to help. And he said to them he was happy to do that, but they had to help him understand some of the medical and psychological things that were going on. And let me tell you, Dave Ellman, to me, is the best hypnotist that ever lived. I know a lot of people believe Milton Erickson was, and there's reasons for that. He was a psychiatrist. But I believe Dave Ellman was, because he was a person who was able to help people to stop many negative behaviors and move on with their lives in a matter of minutes to maybe an hour of intervention. He did workshops all over the United States in the 40s and 50s, where the doctors and dentists would bring their patients and Dave would work with them right there in the workshop and show them how to do this work. So this is not below you, it's actually above you to learn how the subconscious, unconscious mind works so that you can actually help your patients transform their lives. This is the missing ingredient to what you never learned in school. Yeah, you learned a lot of theory, and I use some of that theory in my practice, not because I got a degree in it, but because I learned a lot of it through my degree in both elementary education and the schooling I got in my prerequisites for nursing program I never completed, where I learned a lot of this stuff. And yes, I do understand it, and I use it. But that is not the same as being able to help a person truly transform their thinking and their behaviors, which is what these tools and techniques allow you to do. So I want you to really think about why you got into practice, why you were pulled to do this work. Was it just to see your clients endlessly? in sessions? Was it to keep them medicated, sometimes to the point where they gain a lot of weight and they get negative side effects like tardive dyskinesia and, I don't know, a lot of really bad side effects that these things can do in terms of fuzzy thinking and lack of clarity of thinking, and maybe muted emotionality? I don't think so. Most of your patients don't need any of that stuff. They really don't. I'm telling you, after 20 plus years doing this work in hypnotism and neuro-linguistic programming, my clients didn't need any of that stuff. They just needed to understand why they did what they did from the cause. The first initiating sensitizing event that led to the chain of events that created their anxiety, created their depression, created their whatever. Because what you got to understand is this: there is always a cause and there's always a purpose why a person is holding on to no longer needed defense mechanisms that were created in their subconscious mind to keep them safe when they were in unsafe conditions, usually between the ages of 0 to 7 years old. And you probably recall from your education that this is how our patients and clients develop these problems in the first place. And then they need to be willing to get rid of the secondary gain as to why they're holding on to this stuff. I can't tell you how many times in Quora there are people who ask questions regarding being ill and maybe making excuses as to why it is that they can't let go of it. Or they give themselves the mental health labels, and probably in 85 to 90% of the cases they were never diagnosed. It's a self-diagnosis. And they're not really correct in terms of what they're diagnosing because they don't have the ability to diagnose themselves because they don't understand the criteria. And so I bring that to their attention. And worse is when they try to diagnose the people in their lives when they don't have any credentials to know how to do that. So we need to really help our patients and clients to understand that they do have it within themselves. Their answers are in their own subconscious, unconscious mind. But in order to reach that information, you need to know these tools and techniques. And I do indeed offer a 2-day VIP one-on-one online training for those of you who are interested in actually learning how to do these things. You're going to get a lot of practice because without practice, you're not going to learn how to do any of this stuff. You're going to learn a lot about how to do hypnosis and how to perform the neuro-linguistic programming techniques that are most useful for your patients, depending on the type of patients that you most often work with, which you'll tell me before we set you up to do the VIP program. So this would be a really great way for you to actually learn how to help your clients totally heal their problems instead of just managing these symptoms with medication and endless sessions. And in so doing, you can actually increase your pay rate by a lot because the people with money do not have a lot of time to spend going back and forth for sessions forever. They want quick results and they want to be able to move on with their lives because they have a very different way of understanding what's important to them than those people who are on Medicaid, Medicare, or have insurance to cover them. Self-paying clients are the way to go. They are the most invested. They will do what they need to do. They will not give you a hassle about payments, and they will make sure it happens. These are the type of people you want to be able to attract to your practice. And then you no longer have to worry about insurance. Because insurance can waste a lot of time and effort, and you're not paid for it. We all know this. So I'd like you to rethink how you're going about doing your practice, the type of patients you actually want to bring into your practice, and how you can best help them to overcome their problems so they can move on with their lives. Because every person deserves to have a healthy, fulfilling, meaningful life without having these issues. The only people that we cannot work with in hypnotism and neuro-linguistic programming are those who have personality disorders. I'm not talking about people who just have a few symptoms. I'm talking about the ones who are full-blown personality disordered people. It doesn't work for them. It doesn't work for people who have psychotic features because they have to be able to focus on what we're doing. And it doesn't work for people who have IQ of under 70. That doesn't mean we cannot work with kids. I work with kids very successfully. They're already in the hypnotic state naturally because their prefrontal cortex is not fully developed until they're 25, 26 years old. And they're actually fascinated by hypnotism. I've had several younger clients actually ask their parents to find a hypnotist because they're sick of going to conventional therapy and getting nowhere. So they understand. So it's about time you understood. So if you're interested, the information for how you connect with me to find out more will be in the description to this video. As always, I thank you for spending your time with me. Till next time. Bye-bye, all.